to have you join the Treatment and Recovery Resource Meeting. This meeting is a product of the Treatment and Recovery Committee for the Governor's Alabama Opioid Overdose and Addiction Council. These virtual calls are designed to provide valuable insights, resources, and support for professionals involved in helping someone gain access to treatment and recovery resources. Each meeting will feature 3 dynamic speakers representing different organizations who will share the resources they have available to support our important work in the field of treatment and recovery. These meetings will occur on the first and third Wednesday of every month at 12 p.m. So please continue to join us as they occur throughout the year and feature new agencies with each meeting. The Zoom link will remain the same for each meeting this calendar year. Each agency will have about 15 minutes to share about their services and referrals, followed by 5 minutes for any questions our attendees may have. We ask that all participants remain muted during the presentations. When we open up for Q&A, you can either unmute yourself and ask the question, or you can type it in the chat and I'll ask it for you. Without further delay, I'm excited to introduce the 3 agencies for today, which is Anniston Fellowship House, APC, and Family Life Center. So we will go ahead and start with APC.
Hello, is it all right if I share my screen? I actually have a presentation.
Yes, let me get.
Okay, great. And let's make sure I can do this right. Okay, can you see that?
Yes, you're good.
Okay, awesome. So I'm Morgan Grace. I'm the resource coordinator at the Addiction Prevention Coalition. And what that means is basically I coordinate a lot of our online resources on our website, as well as the resources that we have physically in our office and our resource lists. I am also over the Stop Back grant, which is an underage drinking grant, but that's besides the point. But today I'm here to talk about what we do, APC. We like to say that we focus on awareness, prevention, and connection as an organization. And I'll go through a little bit of each of those and show in what capacity we work. And this is a staff photo, and I was not there that day because I was sick. But so for awareness, we like to raise awareness on substance use, Narcan, mental health. A lot of what we focus around is media campaigns for those. On the left, you can see a photo of our newest physical media campaign, the Be a Hero campaign, talking about how you can get Narcan trained, and that's in partnership with the Jefferson County Department of Health. And those photos, you might actually recognize it. Those photos are in the Galleria. So that was a pretty cool campaign that we did. And then another way we raise awareness is probably one of our biggest events is our End Addiction Birmingham Walk. This used to be known as the End Heroin Birmingham Walk, but in the past, I believe 4 or so years, we changed the name to End Addiction Walk, just to kind of expand that scope, because so many people, there's many different types of umbrellas that people can fall under. And the middle photo is a picture of our students who lead the banner for the walk. And every year the walk happens in the springtime, and it's a lot of pieces coming together, but mainly it's to celebrate those in recovery, to celebrate those we have lost, and to kind of come together as a community to decrease the stigma surrounding substance use. And then we also have a podcast where we have people come on and talk about their journey, their substance use journey, their recovery journey, or just how they got involved in the world of working in prevention and treatment. And that's called the Recovery Cafe. And then we also have, we also do a lot of tabling at events. So anytime someone comes and asks us if we want to be at an event, we always do. We bring resources and tailor our resources to whoever's going to be at that event. So we have resources for parents, resources for students, um, resources for the older population, kind of all across the board. And then so I'll get into what's probably our biggest piece is our prevention. And I have this slide solely for just the student work that we do because that is such a big part of our organization is working with the students who will be the leaders of tomorrow. So we have what are called in focus groups in about 10 schools in the Birmingham metropolitan area. And the in focus chapters are student led, adult guided. So each chapter has an APC staff person working with them to make sure they're able to get what they need. But they're really a peer helper group. They operate different activities in their communities. I have some pictures up here. A lot of them are of Fairfield because that's my school that I'm over. Um, but they do things like pack hygiene kits for their community. They put encouraging messages up around exam time to kind of keep students positive. Uh, they write letters for people in recovery, for people in treatment to receive kind of positive, encouraging messages. Um, and then we also have scholarships that we give to a few of our seniors every year. Um, and they can apply that money. It doesn't have to necessarily go towards college. It can go towards tech school, anything like that. But then through our in focus chapters, we also have leaders on our youth advisory council. And that middle picture of all of those students at the airport, we take them to a leadership conference every year. And they really love that and get to know each other and work kind of cross schools in the Birmingham area. And it also exposes them to how other students across the country do prevention. And as well as these pictures of students, I also want to say that we do a lot of education in schools. And anytime a school reaches out to us, I know certain things happen, certain events happen in schools. And as much as we'd love to be in there before those things happen, sometimes administration doesn't really think to address those beforehand. And so if an event occurs or like they know that they're seeing a substance there, we will come and we will do education for them to their students. And then we also do webinars through Eventbrite. And we have a bunch of webinars always going on with different CEUs like social work, nursing, many different types. And then the other part of our prevention side, we do a lot more than just students, but that is a big piece. So first, I'd like to talk about our new initiative, the One Box Initiative. So these are boxes essentially that contain a video, and it's sort of like an AED where if you open it, it automatically will play a video that gives you instructions in both English and Spanish, and it will tell you how to use Narcan and what are the steps. And we provide the Narcan along with Jefferson County Department of Health, and we're passing these out to businesses and organizations. So far in the Birmingham area, we have gotten calls about other places, and so we're trying to fulfill those orders. But and this is at no cost to the people requesting a one box. We have those being tracked, and if people need another pack of Narcan, we will absolutely refill that and keep up with those expiration dates as well. And if you have any more questions about that, I can definitely answer those in a minute. But then we also have what we call PERFs, and they're pop-up resource fairs, and we do those in many different places across mainly Birmingham area. We've done them at George Ward Park, Lynn Park, Grace Episcopal. We've also done them at Church of the Reconciler, really anywhere where there's a need. for people to have those resources met. We bring, and you can see down at the bottom left, those two pictures. We bring naloxone, fentanyl test strips, hygiene kits, wound care kits, and safe medication disposal bags. And we have all of those in our office and are willing to provide that to anyone who asks. But for our pop-up resource fairs, we collaborate with other community partners. A lot of times that might be the Recovery Resource Center or One Roof, those kind of hot button items. And we go there and we provide food, or we partner with a church that provides food, and go to where the people are and meet them where they are. And then you can also see on the bottom right, that picture with all of those tents, that's us doing a pop-up resource fair. And then along with that, we also do a lot of mental health trainings. So we do mental health first aid, which is what the top middle picture is. That's people getting trained for mental health first aid. And we have 3 different types of trainings for that. We have adult mental health first aid, which is for adults helping other adults in crisis. And then we have youth mental health first aid. So that's any adult working with youth to try to help them identify youth in crisis and what may be the next steps to take. And then we do teen mental health first aid, and that's really working with students to peer-to-peer help. And then we also do QPR trainings, which is suicide trainings or suicide prevention trainings, and that's question, persuade, refer. And those are about our mental health first aid trainings are a little bit longer. They're usually several hours long. There's a lot of content to get through, but and we do those for workplaces too, schools, that kind of thing. But the QPR training is generally, it can be about an hour long. It's a shorter training. And then we also do the top right photo is of every year we do try to partner with other organizations and do a backpack drive, because we think getting those resources out to people is very important. And also, like, our organization and other organizations can put their information so that that actually gets sent home to parents. And this year, I believe we gave out about 400 or 500 backpacks. And then, okay. Yes. And then we also focus on the connection piece. And for us, what connection means, it can look like our resource list. We have many resource lists in person that we always bring to events, and that I'm updating constantly. And we also have a lot of resources on our website. So I actually have an image of our website over here, and we have a find help section up at the top. And in that section, you can find different resources for whether you're a parent, whether you're actually a teen. We also have the restoration resource page, which is for people who have been recently justice involved, or maybe just got out and are looking to start over. And then I have a picture of our Jefferson County resource list. We largely work in Jefferson County, but if people have questions, sometimes they call and they might live in another county. We do have the locations of different coalitions across the state and can usually guide them to a resource list that would be more helpful for them. And we have done work in Blount and St. Clair and Shelby before, so we have resources for those people living in those places. And of course, another piece of our connection is partnerships, making sure that we are working with other organizations and have contacts there is so important, so that if someone calls with a problem that we might not be able to solve, we know who to call to get them help. And I have a picture of Birmingham AIDS Outreach up at the top right at one of our pop-up resource fairs. And we're constantly reaching out to partners to come to those events. And we also work very closely with UAB's different departments of um, addiction research and Beacon recovery, as well as um, their recovery group on campus too. And then another piece we do are family support groups. And I do not have information on that on these slides, but those are for the loved ones of those who are struggling with substance abuse or substance use. And there are two different locations for those that we run. And then we do also provide scholarships for treatment, and that is more so set up on the front end. So we have organizations reach out to us and ask if we have how much money we have allocated aside for scholarships, and then we're able to cover so many treatment options. Then I have our contact page. Let me also check and double make sure I covered everything in my notes. Again, we do not provide treatment. We're a prevention organization, but we do have connections to a lot of different organizations who do, and we're always looking for more to provide, more great organizations. So if you would love to see your resource on our page, I always love to hear about that. So you can email me at my email is morgan@apcbham.org. And I believe that is all I have. We definitely do a lot of stuff, so it's hard to put into one slide. So I hope I covered most of the big points. But yes, we also have a YouTube where all of our past webinars are posted, an Eventbrite where all of our future webinars are and events. And then we're always updating our Instagram and Facebook with what's coming up. So, yes.
Thank you, Morgan. Does anyone have any questions about APC? All right, you can either say them or if you want to put them in the box, either or. All right, so now we will move forward and we are going to hear from Anniston Fellowship House.
Hey, my name is Jeremy Jones, and I am the clinical director at the Anniston Fellowship House. Um, I've been here been here since 2017, so I've been here a little while, worked my way up. So we are a 3.1 level of care residential treatment facility. We actually offer 3.1 and 3.01 levels of care. We only admit clients at 3.1 though. And so we have been in Anniston since inception. That's our only location is Anniston. We've been in operation since 1968. We're one of the oldest treatment facilities in the state. And so it's kind of, when you think about how long it's been around, it's just, it's a long time. And we have a history. We did a history thing on it a while ago, and it's amazing when you look back over the years at the progression of not only really just substance use disorder and how it's it went from really it was kind of taboo to more understanding and accepting and really more of a treatment based model. So we serve the whole state really. We take assessments from really anybody as long as they're assessed for the appropriate level of care 3.1, then we will take them in. We do have a fee associated with it. There's a $100 entry fee and it's $75 a week, but typically nobody we bring in has any money. So we accept everybody without the need. Nobody has to have any money or anything really. Most guys come here with nothing. So we try to help them and provide them with whatever they need, whether it's laundry detergent or soap, deodorant, whatever. Um, and so we really pride ourselves on being able to take, people with no money, because a lot of times when you come from jail, if you don't have family, you have nothing. So, uh, well, I mentioned we're 3.1 and 3.01 level of care. Um, according to ASAM, we might be only 3.1 going forward. Some changes being made, so we'll adapt when needed. But we also do assessments here on site. We're not an assessment facility, but of course, if somebody calls and asks and needs an assessment done, then we do them, and we'll refer them to wherever they need to be referred to, or wherever they prefer to be referred to. We don't just only do in-house assessments. So we're happy to refer to, CED or Alithia, or outpatient, wherever they prefer, and wherever they're assessed to go. We do a lot of work with Ross. We get a lot of referrals from Ross for assessments. The local Ross workers reach out to us a lot to do assessments. And so, we do assessments and just residential treatment, basically. So for referrals to our agency, we try to only accept, we'll accept them any way you can get them. We've had people hand deliver them and fax them and everything else, but we really prefer them to be emailed to annistonfh@outlook.com. That's will get you to our intake coordinator, who is Gary Cootie. And so we just ask that the assessment be complete, primary diagnosis of substance use disorder, and we need the UNCOPE screening to go along with that, and of course demographic information. And so that's really the only requirements. Male, 18 years of age. We only serve male population, male adults. So we need you to be 18 years old, be a male. And have an assessment for 3.1 level of care. Other than that, there's no qualifications. We can accept sex offenders because we have daycares next to us. But other than that, there's not really any requirements for admission. We try to, be fully inclusive, and accept anybody we can and help anybody we can. And I think we do. I think our team and our guys do a pretty good job. And so don't think we're pretty simple. We don't do too much more than that. So I don't know what else I can really say. But if there's any questions or anything, just shoot them to me and I'll be happy to answer. If y'all have any questions afterwards, like I said, you can Google us or look us up on the state website. It pulls up all the correct information. You can reach out anytime. We always answer the phone, always. Sometimes that can be an issue, but we always answer the phone. So if you got any questions or concerns, please call them, and we'll be happy to help any way we can. Thanks.
Thank you, Jeremy. If anyone has any questions, they can either put it in the chat or just say them now, either or. All right, and now we'll hear from our last agency, which is Family Life Center.
Hello, my name is Annie Newby. I'm the clinical director at Family Life Center. I also have a presentation if I could share my screen.
Yes, let me give you access.
Okay. You guys see that?
Yes.
Yep, okay. So Family Life Center has been around we just had our 30th anniversary last year. We've been serving since 1993. And our motto is bringing the hope of health and wholeness to those whose lives have been devastated using alcohol and other drugs. So we're a nonprofit treatment program. We are state certified for those with or at risk of substance use disorder And this presentation is a little older. I was trying to update stuff earlier. We have 10 locations now in Alabama. Our focus is on counseling for individuals, including group counseling, family counseling sessions, and then we also cover issues that arise from the use of substances, including legal issues, parenting, domestic violence, and we also offer anger management courses as well. So our mission and values at Family Life Center, our mission is to provide services, education, and support to individuals, couples, and families with an understanding that faith can play a critical role in the treatment process. We're pleased to offer a program where counseling and spirituality can join hands. In this, we provide an option for those who desire a faith-based approach to recovery, but that is not a requirement, not a required part of treatment. It is just an additional service that we can offer. All right, so what services do we offer? So I mentioned we have 10 locations. So there's 10 outpatient offices and there are 2 inpatient facilities that we now operate. So we have a inpatient facility, Rafa Men's Treatment Center in Gadsden. And that offers 3.5 and 3.1. And then we just recently opened, as of about a week, 2 weeks ago, our women's inpatient treatment facility, which also offers 3.5 level of care and 3.1. So we're excited for that new program that we got open. It's over in Fort Payne. We also offer, in our outpatient offices, we have 2 locations that offer intensive outpatient. That's in Atala and in Scottsboro. And then the rest of our outpatient offices, all 10 of them offer 1.0 level of care. And I have all the locations listed later on at the end. But we basically serve North Alabama area. We're kind of working into Central Alabama a little bit. But at our inpatient facilities, we'll take people from all over the state as well. So we offer medication-assisted treatment. We don't specifically have a doctor on staff, but we partner with MAT clinics and help get clients assistance if they would like to utilize MAT as a part of their recovery. We also have the SOAR grant funding, so that can help pay for medication as well. That anger management class that we offer case management, peer support services, state assessments, and referrals to other agencies. We also accept private insurance, Medicaid. We have grant funding such as the SOAR grant, and then we also have self-pay options and a sliding fee. So we definitely don't refuse services based on ability to pay. We will work with people where they're at. So we make sure everybody gets the help that they need. All right. So here's some impact statements that we have too. One of our clients said, "I'm not ashamed of my past. I had to go through it to get to where I'm headed. Is the journey easy? No. Is it worth it? Absolutely. God is using me to show others that the mountain in front of them can be moved. I hope my testimony gives hope and shows how good God is." And then another was, "I asked to be put in drug court. That experience was the best thing that ever happened to me. I was scared, I was nervous, I was afraid of failing. But every Friday I went up before the judge and told him how my recovery was progressing and that I wasn't using any longer. He believed in all of us." We do partner with drug court programs in all of the counties that we serve. We work closely with the legal system to assist people who are struggling with legal issues as well as their substance use issues, as well as working with DHR in many counties as well. So you can get in touch with us in person at one of our locations. Our website is familylifecenter.com. We have, that's a main office number, which pretty much you can get anyone if you need to, is 256-697-0770. We also have Facebook, Instagram, LinkedIn, and Twitter. So here too is where I listed our levels of care at different locations. So we just opened our outpatient office in Athens, which is up in Limestone County, in April of this year. We have an outpatient office in Atala, which is also at Rafa Men's Treatment Center, but there we provide 1.0 and 2.1. We have an office in Center, Alabama, Decatur, Fort Payne, Gunnersville, Huntsville, Oneonta, Pell City, and in Scottsboro. We also offer intensive outpatient as well as general outpatient. Our residential program at Rafa Men's Treatment Center is 3.5 level of care and 3.1. We also have a transition house on campus that a lot of the men utilize once they complete the program to stay in that safe, structured environment for a bit longer. So they'll stay on campus at the transition house. Treatment is generally going to be 4 to 6 months, but we do individualized treatment based on, we're all different. So depending on what the need is, typically though, we do admit folks at that 3.5 level and transition them down to 3.1, though it's not unheard of to admit someone at 3.1. And our outpatient program is also typically going to be 4 to 6 months that people are in outpatient treatment. Again, though, it's individualized based on the particular client and what their needs are. I know it was mentioned before that ASAM's changing and levels of care changing, but knowing that addiction is progressive, ongoing condition, I kind of like where things are moving, that we're going to keep people engaged in services in some way or another, maybe for a longer period of time, instead of this model that we've had where, you get a certificate and you think you're cured and then you're back in treatment 6 months later, so I'm going to stop sharing so I can kind of see everybody. But as far as referring to us, we do have emails. We have assessments at familylifecenter.com is where we will usually accept assessments for our men's residential facility. We did start a new one for the women's, and it's just assessments women at familylifecenter.com. So you can start referring women to the inpatient program there. And you're always welcome to email them to me. It's AnnieN@familylifecenter.com. I'll get assessments where they need to be too. We are, I think I covered that we're state funded. And we're a Medicaid provider as well. So we'll assist people to see if they qualify for Medicaid and use Medicaid if they get it. I think that answered all the questions that were listed for me. Does anybody else have any other questions?
Thank you, Annie. Yes, if anyone has any questions, they can either put it in the chat box or just say it now, either or if you have questions afterwards, we can always reach out for you guys too. All right, so we will go ahead and wrap up. Thank you for joining. We hope you were able to learn something new about a resource available to you in Alabama for treatment and recovery. Please join us on October 16th for our next virtual meeting and have a great day. Thank you, everyone.